Hi, it's Dr. Mary Tipton with Blossom Health Direct Primary Care. One of the questions that I get quite frequently is a concern about cost, i.e., I just can't pay for my insurance premium every month and a direct primary care membership. It just doesn't make sense. Of course, I totally understand that paying a really high premium plus a direct primary care membership is hard on the budget, and I truly wish insurance wasn't so expensive and so little value to my patients. This is a new concept, and I get that it's hard to wrap our brains around because a lot of people don't have control over the money that's taken out of their paycheck. They don't have a lot of choice over what plan their employer tells them that they just have to have for their health insurance. And yet, I really believe that this is the way that we're going to change things. And try to be brave with me, and we will learn ways to blaze new trails and to find out real cash prices and to make the argument that we should have control over all of those dollars that are taken out of our paychecks for our own health care. Again, I understand that it can be expensive to add a direct primary care membership to your budget every month, but I'm going to pledge to try to find out more ways to make that make sense for you and also for me, and hopefully we'll find a way through this together. One of the ways that I think my patients are going to be working around this is by looking for other ways to redirect some of that money that they're spending on health insurance premiums that they're not getting much value for and directing it towards a high value direct primary care membership. For example, you might be able to renegotiate with your employer that the $1,000 a month that's going to your health insurance plan could be adjusted to have 150 directed to a direct primary care membership, to a health share savings account, to some sort of way in which you can control those dollars and then utilize that for that membership. If you think about it, if you pay a direct care membership for a whole year and it's around $1,500, I mean, that is very little in the terms of what health care costs. For example, you could just have an ER visit, and even just the out-of-pocket cost to you would be way more than that. Or if you had any sort of procedure, or even if you had a screening colonoscopy and then it ended up having polyps, and then all of a sudden it goes to your deductible and you have to pay all of it, the $5,000 to $8,000 for that procedure is a lot more than what you would pay for a guaranteed access to a high quality doctor for a direct primary care membership for the entire year. You might be really surprised to learn how expensive your free healthcare is. Free, I say in quotes, because really you're paying copays, you're paying high deductibles. A lot of times you're paying a percentage of a really high price because it's a insurance price and not an actual price. Those are some of the ways that you might be able to adjust your dollars that you're spending on healthcare to make it make more sense to put that towards a fixed rate, known, transparent pricing model in which you will know that you have access to a physician that you know and trust and that you can get in. You also might be surprised to realize how expensive healthcare can be if you can't access it, or if you have really long waits and you really don't get adequate care. I do see a lot of people that have gone maybe 2-3 times to a doctor or a physician replacement, like a nurse practitioner, and not gotten adequate care, and they spend a lot of money on that. And then if they were able to get the answers more quickly and the correct answer, they would have done a lot better and saved a lot of money and time. Again, thank you, and if you have more questions, you can check out the membership and services pages on my website, and that is blossomdpc.com. Thanks.